Sometimes women's health can be oversimplified, like you have your OBGYN and then that's it. But there are other options, and one Twin Cities practice is making it their mission to create a healthcare team that works for each individual woman, often including certified nurse midwives in their care.
And today we're going to Southdale OBGYN in Edina to meet a young mom who says that type of team approach was exactly what she needed as she welcomed her babies into the world.
So Cindy, tell me about your babes. We're in like the thick of it. We're in the same zone with the babies.
Yes, I have a 2.5-year-old son named Theo, and then our youngest is a 6-month-old, and his name is Lincoln.
Oh my gosh, those are really great names. That's so sweet.
When I met with the team, and actually first met with Dr. Swigert, I had no idea what the difference between an OB and a midwife was. I mean, we were clueless. And so just understanding that difference, actually, she helped guide us to midwife care.
Nikki, I love that we're talking about this today because I think it is so important for women to understand different options that they have when it comes to care, particularly in that really exciting but really stressful time of when you're planning or expecting to have a baby.
Certified nurse midwives, we begin our core education as registered nurses.
Great.
And then we get an advanced degree, a Master's of Science in Nursing with a specialty in midwifery.
Across the globe, midwives have been involved in obstetrical care for centuries, and they provide a level of comfort and a personal touch that we are not always able to give as physicians.
Our specialty is pregnancy, labor support, whatever that means to the patient. So it could be no medication, it could be an epidural. We're just there to accompany them on their journey.
I just have a million questions. I'm just inquisitive. I'm a planner, and just learning from the team that the important part is getting mom and baby healthy, right? And getting baby here healthy. But being able to have a team to answer all my questions, I think, was the thing that stood out to me the most, is just being able to ask and get comfortable with what I needed to know. Because
of what we do, we have the time to spend. So physicians, OBGYNs, not only do they work with pregnant women, they also work with gynecological problems. They have to do surgery. They're on call for emergencies. That's not what midwives do. So we have the capability of spending more time with our patients, getting to know our patients. And that also works for if something does become high risk.
If there's a patient who is in our midwife team and develops a medical complication of pregnancy, that patient can then be co-managed with us, so they can still maintain that relationship with the midwife throughout their pregnancy and delivery, even if we have to get involved.
You have to have a village to get the job done, really, and it ended up being fun, which sounds a little crazy, but it was really, really fun. We all had laughs, and when you're spending that much time with somebody, it's so important to feel comfortable. Knowing when you have the right people in the room, it doesn't matter what's going on. It matters about the moment and that you're being cared for and that you're having a good time, because it can be stressful or it can be fun, and it can be both, but just being able to be comfortable.
What's really special is if you get to see someone at their first new OB visit, you get to see them throughout the pregnancy, you get to be at their birth. It's amazing.
Isn't that a sweet family?
Very sweet family.
It's just so cute. Southdale OBGYN wants to set up the right care for women in all stages of life. So they have 2 locations. They're in Edina and Burnsville. And you can visit twincitieslive.com for a link to make an appointment.
All right, up next, a Cottage Grove homeowner is thanking Pinterest for his outdoor Halloween decoration ideas. And Kelly is going to take us there next.
But first, let's take a look at the Twin